And in another story, many doctors now use genetic science to diagnose and treat their patients. Sometimes DNA can predict a child's risk for disease before it's born or even conceived.
My name is Todd Kelson. I earned a PhD in human genetics. I've worked at a genetics clinic doing counseling. I've been teaching at BYU Idaho Ricks College for 16 years, teaching the genetics courses each semester. With genetic engineering today, we find that many of the techniques are mostly in diagnostics, meaning that we can sequence the DNA, we can determine the code, and from that code we can figure out what traits that person is more likely to have. We also have the ability to go in and make some changes. However, much of that technology is not as advanced as the diagnostic technologies. We can go into a fetus, into a newborn, into a young child. We can change the DNA, that's gene therapy, but it's not as extensive as the diagnostic therapies that are being done is. The ability to change that is less likely because changing the DNA in every cell in the body is very difficult to do. The techniques are there for some diseases. For example, they're currently doing gene therapy for muscular dystrophy, for macular degeneration. So for some diseases, they're actually able to go in and change the DNA sequences and treat the disease that way. But for most of them, that ability is not going to be there in the near future. Maybe a generation down the road it will be, but in the near future, we won't have the ability to go in and change lots of DNA sequences. For example, that there are DNA changes or specific DNA sequences that enhance athletic ability or intellectual ability, musical ability. There are also those associated with disease. As we find out more and more of what those variants mean, we can start to make predictions as to the predisposition that somebody might have for a certain disease, say heart disease or lung cancer. We can find out what that person's predisposition is.
I actually wouldn't want to know that. I mean, I think that kids will need to explore their own venues. And I mean, we homeschool right now, and part of it is because I want them to be free to study and be interested in the things that they're sincerely interested in. I just think knowing that would kind of mess with that process.
I would like to know it, and I think it would be hard to. I think it would be hard not to make them do that, but I think it would be to your advantage to know. And then if they did show interest, then you would know to make the sacrifices to make it happen.
But just because they have the genetic disposition to doesn't mean that that's what they're going to love.
No, but if they liked it and you knew that they could be good at it, then I think that would be useful to know.
It seems like today the moral debate would be mostly with, if we can do it, should we do it? If we have the ability to make a diagnosis that will change a person's life, should we tell that person at a young age what their future will be?
And I don't think it's right. I was just thinking about my family, and we have a genetic syndrome in my family, and I thought, if we were to change that in our family, my family wouldn't be my family. And my sister, she's deaf, and she's, has mental retardation, and I just think that that's part of God's plan for her. And if we were to fiddle with that and change that, I think that we would be crossing lines that I don't think we should cross.